and there is a very true report from March of 2023 saying it's a very serious exam, is very serious disease. So it's here. Both exams are here. Let's see how can we analyze it. So let's go for today's exam. Diffusion weighted sequence right there. Axial. Let's see if there are any new lesions. No. Diffusion, no bright spots on diffusion. So ADC map is not of use because it's not going to help us. Let's go for a FLAIR. Oh, there is a bunch of lesions right there. Confluent periventricular lesions, especially on the peritrigonal regions and around the posterior horns. There is even a cerebellar lesion right there. I hope they did a volumetric FLAIR. They did. So let's just go for the volumetric FLAIR. It's usually what the only sequence we need to evaluate besides diffusion and post-contrast. But to localize new lesions, volumetric FLAIR is the most important sequence for sure. This is a node scanner because there is way too much noise on such a sequence. So this hides tiny spots of disease behind massive noise. See how noisy this is? How noisy the air around the patient is. So this is a clear sign of a badly maintained scanner, a very badly maintained coil, and also the positioning is wrong because there is a duplicate artifact right there. So the scan itself wasn't properly set, which could be the sole cause of this noisy thing. So this is really noisy. There is also a lesion right there on the bones, on the mesencephalon, temporal lobes, occipital lobes right there. There is deep white matter. There is subcortical white matter and periventricular white matter lesions. They are elongated. They are mostly related to this region, really close to the corpus callosum and also affecting the corpus callosum. So it's okay to call it demyelinating multiple sclerosis lesions. I don't tend to put the terminology, the term multiple sclerosis, because it's a histopathological term. It's not a imaging term. It's a pathological diagnosis. A thing you should get from a biopsy or a necropsy. So this is a clear sign of a malacia, gliosis with a central focus of malacia right there. This is a confluent lesion. There is malacia right here and gliosis right there. So this is very much worse than that first case we saw early in the stream. It's a Fazekas 2 for sure, a very classic supra and infratentorial demyelinating disease, most commonly called multiple sclerosis for sure. So the rest of the brain seems fine, nothing major. Let's see if we have any enhancing lesion. Just scroll slowly up and down, looking for enhancing sites, not enhancing, no enhancement whatsoever on those mostly sick sites, the sites of the larger lesions. If those lesions are acute, they should show signs of diffusion restriction, and sometimes even contrast enhancement. So we have two volumetric acquisitions, both FLAIR and post-contrast, on this November scan. Let's see the previous scan if we can see anything. Just this is the contrast enhancement from the previous scan. No, it's all right. Let's see if we have a volumetric flare on the no. Once again, they didn't do a volumetric flare previous to this scan, so we won't be able to do a proper follow-up because we can't really compare those exams, and they did even exclude the lowermost portion of the cerebellum. I'm just going to check here. So this is this. Just go for a regular flare to see if there is any major changes. Right there. It's quite similar. Right there. Let's see. Yep. Really similar there. What the